Right, I make it 10 o'clock. Good morning, everybody, and welcome to the People and Health Scrutiny Committee meeting of the 28th of January 2021. Thank you, everybody, for coming. My name is Jill Taylor. I am a councillor and I'm also the chair of this committee. This is a virtual meeting, which always makes it quite difficult for the public and to some extent makes it quite challenging for councillors and for officers. What I'm intending to do this morning is just go through a roll call of the committee members, which will help the public to have the names of all the committee people. And I'm also going to go through a list of the officers, because there's quite an extensive list and I'll just read those out. So if I can go through a roll call, as I said, my name is Councillor Jill Taylor and I'm the chairman. Could I ask, is Molly Rennie, who is my vice chairman, is she online, please?
Yes, I am here. Nice to see everybody.
Thank you. Councillor Rod Adkins?
Yes, here, Chair. Thank you.
Thank you. Councillor Jean Dunseith?
Here, Chair.
Oh, that's lovely. Good morning, everybody. I understand I've got apologies from Barry Gorringe, which we'll come on to in a moment, but if Barry is there, could he speak now, please? Thank you. Councillor Nick Ireland?
Yeah, present, Chairman.
Councillor Robin Legg?
Present also.
Councillor John Orell?
Hello.
Hi, John. Councillor Mary Penfold?
Good morning, present.
Thank you. And Councillor Bill Pipe?
Good morning, everybody.
Good morning, Bill. As I say, we've got one or two cabinet members who are in already, but they will be dropping in and out as the morning goes on. I don't expect them all to be here at the beginning, but for the ones who are here, welcome. The officers attending today, in the room we also have Vivian Broadhurst, who's the Interim Executive Director for People Adults, Teresa Levy, the Executive Director of People Children, Claire Shields, Corporate Director, Commissioning, Quality and Partnerships, Mark Blackman, Corporate Director for Education and Learning, Tony Meadows, Acting Corporate Director of Commissioning, Andrew Billany, Corporate Director of Housing and Community Safety, Sarah Jane Smedmore, Interim Head of Locality and Strategy, Vanessa Reid, Director of Nursing and Quality, she's from the CCG, as is Sue Sutton, Urgent and Emergency Care Programme Director for the CCG. Bridget Downton, Head of Business Insight and Corporate Communications, Andy Frost, Service Manager for Community Safety, Kay Wilson-White, Community Safety Business Manager, Rebecca Forrester, Business Partner, Policy Research and Performance, David Bonner, Service Manager for Business Intelligence and Performance, Kerry Oliver, who is producing this meeting, Judy Saunders, who's also producing it, and Fiona King, who's the Senior Democratic Services Officer. And could I welcome Fiona to this meeting? She is the new committee person from Democratic Services, or rather she's new to this committee, and she's been a huge help in setting this meeting up. If I can now go on to apologies, could I have apologies, please?
Apologies from Barry Gorringe.
Thank you. Any other apologies?
No other apologies received.
Okay, thank you very much. Declarations of interest. Does anybody?
It's Councillor Orrell. A standing declaration that I'm an active GP but have a dispensation but would withdraw anything related to GPs. Also, I'm a trustee of the Lantern, which helps homeless people.
Okay, thank you.
Nick.
Hello, Councillor Ireland.
Yep. So for clarity, my wife is also a trustee of the Lantern, since that's on the agenda, and I'm also a partner governor to Dorset Healthcare.
Okay, thank you. Any other declarations? Right, thank you very much. So we go on to public participation. Now I'm just frantically trying to find two of the questions that were going to be asked this morning. We have, here we go. I do apologise if I'm looking around, it's because I've got a number of screens going here. I'm not ignoring the people who are in the meeting. If I take, there are two questions from John Andrews initially. These two questions came to the agenda last time, and I thought it would be worth putting them back onto the agenda this time, because it has been quite difficult, and this isn't meant to be derogatory. There has been issues getting the answers, but I think there's also a wider interest in this because there appears to be a number of councillors, including MP, actually asking the same questions. So I thought it would be worth putting them back onto the agenda. I think, I can't remember whether it was my vice was going to read them and I was going to do the answers.
I'm sorry, I didn't know you were asking me to read them, but I will happily read them. I'm concerned, this is the question from Councillor John Andrews. I'm concerned that the continued closure of the Sherborne-Yeatman Hospital minor injuries unit in Sherborne will become permanent. The service is vital to residents of Sherborne and the rural Sherborne residents. It is also putting undue pressure on the already stretched surgeries in Sherborne, Yetminster, Milbourne Port and Cerne Abbas. People are now using surgery nurses as a substitute, as the alternative signposted is either Shaftesbury Hospital or Dorchester Hospitals. I am sure that this has also resulted in ambulance calls. Chris Loader keeps asking questions about an opening date, but keeps getting fobbed off by the Dorset Health Trust, CE. My question will be, when will the Yeatman and other MIUs in Portland and Blandford that are currently closed be reopening?
And we have been provided an answer from Jane Elson, who's a Service Director for Integrated Community Services, Dorset Healthcare University NHS Trust. And the answer she has given us is, we are still responding to the pandemic and have a duty to minimise the spread of infection to ensure that services remain resilient and to optimise the Dorset system preparedness to respond to any rise in rates of COVID-19 infection locally, the latter of which we are now experiencing. National guidelines remains that walk-in patients should be avoided to prevent the spread of COVID-19. Given the current situation, it is not possible to give a date for when the MIUs will reopen. We continue to offer telephone triage by the MIU/UTC clinician, who either gives advice and signposts to other resources, or if appropriate, offers an appointment to attend another MIU/UTC for a face-to-face consultation. This new clinical pathway has significantly reduced the risk of exposure and spread of COVID infection by preventing large numbers of patients presenting in the confined space of waiting rooms during peak times. We can now manage patient flow more efficiently and consistently, supporting many patients through advice and signposting without the need for them to leave home. Safety must always be our #1 concern. We continue to keep this under review alongside national guidelines. There is then a second question from Councillor John Andrews, also related to Yeatman.
Yeah.
If you could read that out, please, Councillor Rennie.
Yeah. During the early stages of the pandemic, the matron of the Yeatman Hospital left her post to take up another position. We in Sherborne now share a matron with Blandford Hospital. It is the intention to fill the vacant post of matron at the Sorry, have I missed?
Sorry, you're. Oh yeah, go on.
Right. It is the intention to fill the vacant post of matron at the Yeatman. If so, I'm missing I'm really sorry. It feels I'm missing a bit of this out, but I'll carry on. If so, when, as these posts were deemed full-time prior and during the pandemic, and now we are in the second spike, are probably more key now that strong leadership, not part-time leadership, is required. After all, we don't have a part-time chief executive, or is that the next step?
Thank you very much, Councillor Rennie, and I apologise for interrupting you.
That's fine.
The answer is also from Jane Elson, and she has said the position of the matron covering both Blandford and Sherborne during the pandemic has been reviewed. We now have an acting matron covering Sherborne. This will be reviewed again once the pandemic is over. I have been asked by one of the committee members if they can speak on this, so I will take that fairly briefly because there's not meant to be debate on public participation, but I will take it this time. If I can go over to Councillor Legg, please.
Yes, I'm very grateful, Chairman, and I'm sure John would have been present this morning. Unfortunately, he's had a bereavement in his family, and we're all very sad about that. The point I'd like to make actually is on the first question that John asked about the minor injuries unit, and I had the experience of taking my stepson to the minor injuries unit in Shaftesbury just before Christmas, and I have to say it worked very effectively by ringing them up and making an appointment and taking him there, and we were then sent back to the A&E department in Yeovil. That's my preamble, as it were. The thing is, I know a lot of people have been trying to get some information about the MIU, as John has, out of the trust, and really the communication has not been very good. And I know, for example, that a parish councillor in the area who's a member of the Apples PPG, Bruce Duncan, was in correspondence with them in October, and he was told that a paper was going to be presented to the clinical commissioning group's urgent and emergency care board in November, but he's had no further communication, and none of us have. So, you know, I was listening to the response that was read out this morning, and there was no mention of this going before the clinical commissioning urgent and emergency care board. So it seems to me the channel of communication is rather poor at the moment.
Thank you very much for that, Councillor Legg. I think I'm personally quite concerned about the wider aspects of this, because we have at the moment got 3 of our MIUs closed, and it's the longer term outcome for these that I'm concerned about, because they have been closed now for the best part of a year. I'm wondering whether, with committee approval, we ask for a short paper back on this from Jane Elson, possibly just for our April meeting. I'm not asking anybody to write reams and reams. I think a paragraph would be absolutely fine. I don't want a 6-page essay on it, but if I could ask Jane Elson if the committee clerk could get in touch with her and ask her to do a really short report back to us for our April meeting, I think that would be quite useful. Is that all right, committee? Is anybody dissenting?
Within that report, Jill, could there be a question about, did it go to the committee that Robin mentioned?
Yes, yeah, we can certainly ask that question.
Thank you.
Is that okay, Fiona?
Yes,
Okay,
Chairman. Yeah, Chairman,
okay.
that's fine.
Okay, I'll talk to you later about this. We have 2 other questions. There's a question from Councillor Barrow, and there's also a question from Councillor Legg, which we'll hear from at the homelessness one. But there is also a late question, or it was a question that was put in by a different route from Councillor Legg, which I think is important that it comes to this committee. So I'm just going to read it. Bridget has been forewarned of this, so will be providing us with an answer. Councillor Legg writes, I would have sent this request to the appropriate lead officers for the 2 scrutiny committees, but as there are none nominated, I'm putting this request to yourself. Dealing with issues arising from the COVID pandemic is probably been the largest function the Council has had to undertake in terms of application of resources and the need for speedy application of most of these resources. I would like to see at least one of the scrutiny committees have this on their agenda, please. And because this is a continuing and significant undertaking of the Council, this should be given top priority. For my part, I see consideration needs to be given to what tasks were given by the government for the Council to undertake, how many of these were completed, and to what level of compliance. What funding was received so far from the government, and how quickly this has been used or reallocated. What tasks were not funded, and how has the Council managed these tasks? What community groups have been helped, and what proportion of their overall needs has this accomplished? If I can go to Bridget for an answer, please, that would be very good. Thank you.
Thank you, Chair. So I've emailed Councillor Legg on behalf of the Chief Executive, who this question was raised with, and Chair, I'll read out my answer to Councillor Legg. Dear Councillor Legg, Matt has asked me to respond to your email about scrutiny of the Council's performance in relation to the current COVID pandemic. I have a meeting later this week with the chairs of the overview and scrutiny, so I will discuss this with them then. I thought it worth making a couple of points ahead of that discussion. As you know, Councillor Wharf chaired a task and finish executive advisory panel looking at COVID recovery, and members of my team will be working with overview chairs to come up with a way of working up a COVID recovery plan, building on the work of the EAP, as well as the best mechanism for monitoring progress against that plan. In terms of scrutinising how the Council has responded to the pandemic, addressing the points set out in your final paragraph, I will discuss this with the scrutiny chairs later this week. This is an important piece of work and we will need to get the timing right. Clearly, officers are in the thick of responding to the pandemic itself at the moment, and we will need to get beyond the current critical response phase so that we can give appropriate consideration to the matters set out in your email. Clearly, at the moment, there is a significant degree of uncertainty around when we will be in a new normal. So at this stage, the timing of the review will need to be indicative. And I assured Councillor Legg, Chair, that we would get back to him once we'd had a meeting to discuss that. And clearly you will want to put this on your forward plan in due course. Thank you, Chair.
Thank you very much. As I said, there are two more questions which we'll take at the item on homelessness, also from Councillor Legg and from Councillor Barra. If I can move on to the next agenda point, please. That is item 5, integrated system response to winter crisis pressures. I wonder if I could introduce Sue Sutton.
Chairman, excuse me, it's Fiona here. We haven't done the minutes yet.
I was just going to say that.
Oh, sorry.
Sorry to interrupt you.
That's quite all right. Sorry, I missed them. They're on the agenda after apologies. I got a bit carried away with declarations of interest. We've got 2 minutes, 2 sets of minutes to approve today. We've got the minutes from the 2nd of November, which was an ordinary scrutiny committee meeting. And we've also got the minutes from the 11th of December, which was the budget scrutiny meeting. Are there any comments on them about accuracy? There have been a few things come in that have been changed, so the minutes are accurate. Is there anything anybody would like to mention on the minutes? If I can come in first, there is an item where there was a working group set up to look at the quality reports that were coming in from the trusts. If I can hand over to Councillor Orell, because we have had 1 minute of that, one meeting of that, and it would be really good if Councillor Orell could just report back on the work that this working group has done.
Thank you, Chair. So the working group met with members of SWAST, quite a productive meeting. We reviewed their performance metrics. It's a bit of curate's egg. They've done very well in most areas and had certainly improved their high level categories, the most urgent ones. They'd improved their performance. They did acknowledge that they needed to concentrate more next on the middle ranking ones that weren't the most critical but had slipped. So they gave it assurances that they would be addressing that one in the future. So we were very it was a useful meeting. They did say that they're moving away from single unit response cars towards 2-person ambulances, with the view that they are better for conveying people to hospital, and that's something we will be watching, especially as it relates to Swanage. But as in general, it was a very useful meeting, and they are performing quite well against national benchmarking, which we were reassured by. Thank you.
Thank you very much, Councillor Orrell. I must admit I was in that meeting. I thought it was an extremely good meeting, and we have responded on behalf of the Scrutiny Committee, which will be included within their audit report. If there are no other comments, could I ask, do we need to vote on the accuracy of the minutes? Fiona? Do you need
No,
to vote?
if there's no comments and everybody's in agreement, we can move on.
Okay, thank you very much. I'm hoping nobody is going to shout and say they're not in agreement. If we can then move on to item 5, which is the integrated system response to winter and crisis pressure. If I can pass now to introduce this item to the committee, if I can go to Sue Sutton, who is the UEC Programme Director for Dorset CCG. Good morning, Sue. I don't think we've had a chance to meet yet, but welcome to this committee.
Morning, thank you, Chair.
Good morning.
Good morning, everyone. And sorry, I can't change my background for some reason, so you can see the inside of my office, but hopefully that's nice and tidy. So yes, I'm the Programme Director for Urgent Emergency Care at Dorset CCG, and I also took the role of Winter Director since October. So in your paper on figure 1, page 37, you'll see how the report describes the command and control governance that we have in place for the integrated care system. The Incident Control Centre within the CCG itself was established last February, but what we've done is we've put additional infrastructure in for winter, so very mindful of the usual winter pressures that we face. And with the added complexity of COVID, what we needed to do to strengthen that. So since October, we've had a winter room that's set up very much in line with the approach taken by NHS England and Improvement the region, so at South West. So we've brought together a range of functions. So the winter room comprises the Incident Coordination Centre, also the wider emergency planning function as you would have as business as usual. The usual winter planning, which of course is more complex this year because of COVID, EU exit, and all of the support for all of the meetings that are in place across the Dorset system for the COVID response and recovery, and also linking to the local resilience forum meetings and arrangements that we are a partner within as well. So as part of having that kind of stronger partnership approach to our winter response, we established a tactical group. So we had a silver strategic group in place since the beginning of the pandemic. So we've strengthened that with a tactical group, a bronze group from October, and I chair that bronze group. We have really strong representation by all system partners, and there's a very strong level of commitment. We have a consistent membership, and we've been meeting daily during January as the pressure has increased, and we've seen increased pressure on our services. So October, November, December, we were meeting 3 times a week under usual circumstances, and we've increased that to daily, so we can be more responsive in our approach. So section 2 talks a bit about the importance of good data. So we now have many data sources at our disposal, and I'd like to thank all partners, including the council, for your cooperation with that. As it's not without its challenges, as you would imagine, but we now have a range of really good data sources, and that's really important for helping our decision making at tactical level, and then informing how we make recommendations to our silver strategic group for the system. The paper goes on a little bit to describe the work around planning for surge and our process for escalation. So as we would in usual years, we've got our organisation level winter plans, which we supplement with some planning around what we can do at system level to add value. In addition to that, this year we had a more specific plan for December, going into the festive period and over those bank holidays. And more latterly, we've been working on a plan for Q4, which we're just finalising. That said, it is a very live plan that we continue to refine and flex on a daily basis as the tactical group responds to the pressures of the day, and looking at what we think is coming ahead. The triggers that you can see on this colourful table here, they stay not finalised because we are continuing to review and refine them literally on a daily basis. And the point of these is for us to be able to understand where our particular pressures are in the system, and then what actions and escalation we may need to take as a result. So part of that work obviously is in understanding the pressures across the system. So our hospitals, for example, but very much a focus on the care home sector as they face various difficulties. So the same as the rest of the system with workforce, for example. And there's a lot of work going on there at the moment to understand our capacity across the system, including the care home sector and community hospitals, etc., etc. And I'd like to thank Dorset Council colleagues for your input into all of that work. So in summary, if I may, the governance is well developed. Partners are working really well across the health and care system at both tactical and strategic level across that command structure with very strong commitment, like I say. There's obviously still much to work to do, recognising where we are in the response and recovery process, this third wave in particular, and we'll continue to develop our intelligence and respond to the changing pressure and environment which faces us on a daily basis, so that we can do the best that we can. So I'll pause there. Thank you for listening, and I'm of course happy to take any questions. Thank you, Chair.
Okay, thank you very much. So you're breaking up a little bit at the end there, so we'll keep our fingers crossed we're okay here. I've got several councillors asking to speak at the moment. Councillor Ireland, would you like to come in, please?
Sorry, I was on mute. So I don't have any comments to make now. Thanks.
Okay, thank you very much. Councillor Orell, would you like to come in?
Thank you, Chair, and thank you, Sue, for the presentation. I'm very reassured by the level of detail and the fact that the NHS and other agencies are working well together. This is the beauty of a public health system. In this country, we're under pressure, but we can overcome some of the difficulties by cooperation. So that's great. I was slightly perturbed by the escalation levels not being finalised, but I can understand that. It is a particularly unique situation we're in with the pandemic, and losing so many staff through sickness and units going offline must make it quite a struggle. So I'm worried that if the escalation levels aren't fixed, whether it's capacity that feeds to the escalation levels, but I can understand why it has to be that way around. As an illustration of how it's working, if we go down to 4.2, the thing about writing reports in advance is by the time we get to these meetings, the dates have passed. So you could 4.2 mentions actions you might have taken by certain dates. So to prove it's working, could you just let us know how those escalation levels have worked? I hear rumours that people have been moved to Devon, which is probably a good thing because there is capacity in the Nightingale Hospital. So could you illustrate how the system is working at the moment by updating paragraph 4.2?
Yes, thank you. Chair, would you like me to respond to that question now?
Yes, please, if you could.
Thank you. Sorry,
I was just slightly distracted then.
Oh no, it's okay. I'm just checking that you could hear me okay. So thank you for those. So I'll just take those two points in turn then. So just for your assurance, there was a version 1 of those refined triggers. So we had triggers in place that were part of usual business pre-COVID. So we had a set of agreed triggers. We refined those as part of our winter planning, and they were agreed by the Silver Group on the 8th of December. So the latest version that's in here has actually changed again since. I think the wording is probably not as helpful as it could be. I think the more appropriate language is we would continue to refine them on a daily basis because
Sorry, we missed the last sentence.
Health and care.
We missed your last sentence. I'm sorry.
Sorry about that. There was an additional set agreed on the 8th of December, and then we continued to refine. So we had a BAU, a business as usual set. We refreshed them for our winter planning. They were agreed on the 8th of December, and we've been continuing to refine that set. So it's ongoing work, but we do have an agreed set of triggers. It's complicated because of the complex nature of the health and care system, and you could be triggering in one point, so you could have real pressure at the hospital front door, for example, but we could have good capacity elsewhere in the system, in the community, for example. So sometimes there's lots of nuances, and we're trying to just refine those triggers so they're truly reflective of system pressure. So the second question around 4.2. So we have a Q4 plan. Again, we're continuing to refine that in terms of the way that the escalation works. At tactical level, we seek to agree actions and act upon those actions within the remit and decision making and scope of the group. We escalate to Silver where we have an issue, and we bring a proposed recommendation and solution to Silver. So that's the way that the escalation works. But at tactical level, there are actions that are taking place on a daily basis, mutual aid support across the system and across our various organisations, for example.
Thank you. Is that okay, Councillor Earl?
Yes, thank you, Chair.
Thank you. Could I go back to Councillor Ireland, please?
Yeah, so it was just a comment really, and for information. I know for a fact that Yeovil yesterday Yeovil District Hospital transferred, I think it was 5 patients to the Nightingale in Exeter. So that is happening, but maybe if the officer could answer the question, have we actually transferred anybody as well from Dorset?
We have sought support from mutual aid across the region. So the Southwest has a mutual aid arrangement for critical surge. So we are part of that. We are part of that mutual aid arrangement. We did see particular pressures last week and coming into this week, particularly around workforce, but those pressures have receded somewhat. But yes, we are part of the regional mutual aid as well as our own system, Dorset system mutual aid.
Okay. Thank you very much, Sue, and thank you very much, councillors. We've got a recommendation on this paper that's asking us to consider and comment on the report. Do we wish to make any comments on this, or are we happy with it? How do we want to take this? Sorry, I've got an RTS from Councillor Pipe. Would you like to come in now, Councillor Pipe?
Thank you, Chairman. Haven't heard the last question and the answer. Would Sue like to answer that question? Have we sent anybody down to the Nightingale Hospital in Exeter yet? Thank you.
Yes, Councillor Pipe, we have.
Thank you very much.
Okay. I think from this committee, we've asked a couple of questions. Are we happy with the paper and happy with the report? I'm personally very heartened by it. The part that I did like is that the trigger points are getting reviewed regularly, because I think it's very easy to put in a standard and then try and work to it and make the system fit the bit of paper that you've got. So I'm very heartened that it's flexible enough to be able to flex across the system. And I'd like that sent back. Could I send back to the CCG and your organisation what a brilliant job you're doing at the moment with the pandemic? We all hear the figures on the news on a daily basis, to the point I find it very difficult to hear the news these days. And I think what people are facing on the front line is really, really difficult, and is going to have all sorts of ramifications longer term. So I think on behalf of this committee, I think we would all want to say a thank you to the work of the CCG at the moment, and send that back to staff. If you could do that, Sue, I'd be really grateful. I'm quite happy to put something on paper from this committee, if that is what the committee would like. I'll take that away as an action then.
Thank you, Chair. I'll certainly pass that on. Thank you.
Okay, thank you very much, Sue. And I think okay, we've concluded this item. Thank you very much for coming this morning, Sue. And
thank you. Bye.
Hopefully see you again at some time. Bye. Thank you.
Bye. Thank you.
Okay, so we can now.
Could I please make a point, and it wasn't specifically at Sue, but John Orell made a point at the very beginning about delaying scrutiny too much, and I think that paper showed that that's not scrutiny, but they have continually looked at and updated their responses. And John talks about missing lessons that might have been learnt, and I think that that is evidence of what they've done and what we need to be looking at as we move forward continually. And I'm sure that that's what everybody is doing, but I think that is another form of scrutiny that's not the formal scrutiny. That's just a point.
I think you're absolutely right, Councillor Rennie. If we can move on to the next item on the agenda, which is the service performance. We've got Bridget Downton here to talk about this, but I just really do want to make the point at the moment that we've got the October Q2 papers in front of us. They're largely illustrative because they are 3 months out of date. This was unavoidable, and I do apologise for that. But it's where we are, and because of the change of the committees, and there was a lot of reasons for it. If I can hand over, so basically this is almost a going forward rather than a looking back on our performance monitoring, and I think our performance monitoring has got a long way to go yet, and I think it will go a long way with the plans that are being put in place. But if I can hand over to Bridget to just talk us through this paper, please, so that we have more of an understanding of it. Thank you.
Thank you, Chair. Picking up on the point that you've just made, this is, as you rightly point out, the appendix on this paper really is illustrative, and it shows the red and amber indicators as at October for the area of this committee's interest. Some of the members on this committee will have seen a prototype tool that we're developing that will allow you a much broader, richer, more informed look at performance, and that will be being updated in real time. For those of you that haven't managed to see it yet, we will be demonstrating it on a member webinar. And what I need to do with colleague chairs is talk about how when we move forward, how we use that tool, because the main purpose of that tool will be to help the committees to inform their forward plan. Because if you see a performance trend or something that you think merits some further examination and scrutiny, then we would use this the tool to help program that in the future, and then we would need relevant officers and portfolio holders there to be involved in that debate, because it's not the business of the team of people that pull the tool together, my team, to answer questions on service. Clearly that's the portfolio holder and the relevant officers. So that's the place we need to move to, and that's where we're getting to. So really wanted to give you an update on that. And I guess the other thing, Chair, that occurred to me, and then I'll pass over. I know Councillor Wolf would like to say a few words as the spokesperson for this, sorry, the portfolio holder for this this item. But the other thing that occurs to me is that your committee is a very broad-ranging committee looking at people and health, and this performance report focuses on Dorset Council's contribution to people and health, which obviously is only a part of that. We are working up some measures around public health and around Active Dorset, but at later iterations, we need to get our current version working properly for you, but at later versions, I'm guessing we might want to have a think about how we expand that out to look at broader parts of the system. So I just wanted to say, Chair, that's it's on the radar, but it's the initial one will be looking at our performance and public health and Active Dorset. I think that's all I want to say at the moment. I'm very happy to take questions, and as I say, I think Councillor Wolf would like to add to my points.
Thank you very much, Bridget. Could I go over to Councillor Wolf, please?
Thank you, Councillor Taylor. Hopefully, can you hear me?
Yes, I can hear you.
Thank you. Bridget said much of what I wanted to say, and I thank her for that. We've put a huge amount of effort into developing these performance management metrics, which are still at early stages. And I had a meeting with yourself and Councillor Shane Bartlett where I talked through the system. The purpose of the report here is primarily from a simple point of view to get everybody to be comfortable with the style, format and the sense of what is being said, rather than looking into the detail and analysing the detail, which is A, somewhat out of date, and it's illustrative, and B, you will get more accurate reports as we go along. We're still in the process of building the system, and it has taken, has taken a huge amount of work. And what we're trying to do, and I was having a sort of private conversation with Bridget, which I'll now make public, is I want to get members to use the system as it is before we start to update it too frequently. Otherwise, we end up with an unstable platform. So what I'm looking for is an agreement that this is the right sort of way to go forward, and I would be surprised if it isn't. And then we need to have some mechanism for ensuring that your committee that doesn't meet monthly has an ability to review the data and actually analyse it. And again, as I said at the meeting I had with you, we need to be careful that we don't take a report to your committee. It has 5 or 6 portfolio holders' details on it, and you ask all 5 or 6. I think there's a need to try and, with respect, try and focus on which areas you want to go into on detail, and make sure that you've got the correct portfolio holders there for it. So I'm happy to answer any questions on the style and nature of the report, which I recommend very strongly as a really good start. I would just add one final point, which is we have pulled together 6 different reporting systems, all that had different levels of granularity, reporting, detail, metrics, and it's proved hugely problematical. The team have done a fantastic job, and we've got something that I think will work, but we're still at early stages. So there may be questions on how do you define red, amber and green? Yes, we've got that. How do you define metrics? They are not always defined in detail numeratively at the moment, whilst we get experience of how we're moving forward. So we're still in the process of developing the system in terms of the population of it, but I'm quite keen to leave the system stable for a little while before we add further mechanisms in it. Happy to take questions. Thank you, Councillor Taylor.
Thank you very much, Councillor Wolf. I must admit, I've looked at this system and I think it's extremely good and it's going to be extremely useful. But I think what we need to do as a committee, we need to look at how we're actually going to use it, because there are so many rabbit holes we could just vanish down very, very easily. So it's how we actually, as Bridget said, how we actually work out which bits of it we want to committee. We could spend days going through this sort of information. And particularly if we can start getting some of the wider information that Bridget alluded to onto the system, we are just going to have so much information that we're just not going to be able to cope with it. I've got a couple of people asking to ask questions. Councillor Legg.
Thank you, Chairman. Not a question, luckily for Peter Wharf, about any individual elements of this, but I did note the fact that 8 of the performance indicators there are shown as worsening. That's 8 out of a total of 72, because that includes the green ones, which is a little bit more than 10%. And of the 8, only 2 of them have got entries in the action box. And I'm just thinking, in terms of keeping this thing up to date, if there's going to be a kind of online version of this that members can look at, who's going to be keeping those entries up to date? Is it all going to end up, unfortunately, being bottlenecked with Bridget or some other unfortunate officer who's put all the data entry in, or is it going to be updated by the relevant officer within a particular section?
Chairman, that's a really good question, which I'm happy to answer. We've got a mechanism behind the scenes for doing that update, and we've got a network of colleagues across the council who provide us updates, service managers and those sorts of level of folk across our organisation, managing a range of services, and also a mechanism for signing that off in so that directors are cited as well. But the point that about actions is one that my colleagues all know is very dear to my heart. There's no point in us looking at this information without asking the so what question, and where performance is not good enough, or indeed is going in the wrong direction from a good place, it is absolutely imperative that those measures do have actions associated with them. And that's imperative most importantly for our communities, because we need to make sure we're taking actions to remedy poor performance or keep up good performance. But it's also important for you as a scrutiny committee, because you need to assure yourselves that we are doing the things that you think we should be doing. And there might be some poor performance or some deteriorating performance, but if the action satisfies you, then you'll say, well, that's okay, we'll keep that on our radar and keep an eye, because we think that'll improve it. If there's no action, you've no idea. So we absolutely do need to be recording those, and I'm my apologies if there are some that aren't in there. As Councillor Wolf said, we're still building this system out, but it's a really good point, well made, that is the most important part of the performance system of the actions. Thank you, Chair.
Could I ask Councillor Penfold, have you still got a question? Are you there, Councillor Penfold?
Sorry, Chairman. I was on mute. It was actually answered within the presentation. Thank you very much.
Okay, thank you very much. Could I go to Councillor Wolf again, please?
Thank you, Councillor Taylor. A point that I made to you and Councillor Shane Bartlett, the chair of the other scrutiny committee, and forgive me for using simple language, because it's one that I understand. We need to be careful not to shoot the messenger, and we also need to be careful to be open and transparent. So even though sometimes the information might be concerning, it's important that we don't in any sense try to dress it up or whatever. So I make no apology for the number of reds. They are what they are. They are a little out of date. We are making improvements in terms of reporting. And to answer your second question, the responsibility for populating the data is the responsibility of the end user and not Bridget's team, because I agree with you entirely. We need to be careful that there isn't a bottleneck there. What we then need to do is ensure that we inspect that data to make sure that we are both happy with the performance metrics and the data reporting on it. And that will gradually get more and more data feeding in, but I assure you it is the responsibility of the individual areas, and again you will have the opportunity to question the portfolio holder, who will be ultimately responsible in that instance. Thank you, Councillor Taylor.
Thank you, Councillor Wharf. I think I'm just going to, I've got another RTS into the chat bar. Councillor Rennie, would you like to come in?
Well, I think actually it's been answered when Peter, because of course it takes a bit of time for the message to go into the box. I was worried, and I wasn't, about not understanding about who the end user was when he said the end user, but then I think he qualified it by saying it's basically the person who's in charge of that service. Am I correct?
Chairman, if I think there are lots of users. So I think what Peter was, what Councillor Wharf was referring to was the person who will be responsible for updating the data for you to analyse in response to an earlier question, and that will be the service manager. In terms of end users, the Scrutiny Committee is absolutely an end user of this data, as indeed in due course will be the public, because the point that I failed to make in my presentation, which I should have done, is that as well as producing a tool for the committees to use to inform their forward plans, we also have an aspiration to make the tool available for members of the public and our community, so that they can see how things are going and what our performance is doing. So there'll be a myriad of users of the data in the end. Thank you, Chair.
Thank you, that's made it clear, because I was actually looking at the reporting of domestic abuse, which is worsening, where there's no action, yet I do know an action has been undertaken around meetings and various things for that. So, and of course we're working on figures from backwards.
And I think that's a really good point that Councillor Rennie makes, and it brings it to life, doesn't it, that we have got data in here that and that's why that appendix has got illustrative plastered all over it. When we've got the final tool ready for you, we will make sure that it's got the most up-to-date information in it, absolutely, with those actions that you know already are happening.
Thank you.
Thank you very much, Councillors. I think I just want to sum up a little bit, because this report is just for noting, which is quite unusual on this committee. I think one of the points that Councillor Wharf made is really, really important, that this isn't a tool to hit people over the head with. The role of scrutiny is in being a critical friend. And I think this is something that we really, really have to get embedded within this committee, that we're here to support officers, we're here to work with officers, but we are here to do a job which is holding a mirror to officers and everybody else who works with us. So I think this is an incredibly powerful tool, and it will be an incredibly useful tool. But I think as a committee, we have to actually work out how we are going to use it. We could spend an awful lot of time going down rabbit warrens and not actually doing anything worthwhile. So I think as this develops, it's going to be really interesting. We have got Q3 performance monitoring on the agenda for our April meeting. So I think would all members please have a think about how we want to use this? Because as Councillor Wharf said, we don't want 20 or 10 portfolio holders in on this meeting to answer our questions, but we've got to work out a way of actually working with this information and making the best use of it. This report is for noting. The recommendations are that we note the emerging performance framework and discuss proposed improvements to support the scrutiny function in future, and to note the performance measures that were rated as red or amber at the beginning of October, or the last time they were reported in 2021. And as we've said, a lot of these are out of date. So having said we're going to note that report, I think it's an extremely good report, and I look forward to the iterations of this. And could I please encourage anybody who hasn't seen this, particularly committee members, to take the time to actually look at it and work with it and think about how we are going to work with it. So thank you, Councillor Wharf. Thank you, Bridget. Please feel free to stay for the rest of this meeting, but I'm sure you may well have better things to do with your time. But thank you very much for your input. If we can now move on to the next item on the agenda, which is the response to homelessness during winter. Now, I've held over 2 questions from public participation for this meeting. There's one from Councillor Legg, which I believe Councillor Legg is not in the meeting today, so will be read out. And there's also one from Councillor Barrow. So I think initially, if I could ask, is Councillor Barrow online, please?
Yes.
Good. Good morning, Councillor Barrow, and thank you very much for coming to our meeting today. Could I ask, I think what I'd like to do is initially go over to Andrew Billany just to introduce this report fairly briefly, because we have it before us and I'm sure we've all read it. But if he could just introduce this report fairly briefly, and then I will go over for questions. I will do Councillor Barrows first and then Councillor Leggs, and then I will open it up to any other members of the committee. So if I could go over to Andrew to introduce this report, please.
Thank you, Councillor Taylor. I've just prepared 2 or 3 minutes. Is that brief enough? I could be...
Yes, yep, that will be absolutely fine. Thank you.
Thank you. Okay, I mean, members will have seen the paper, which is hopefully self-explanatory, but it aims to give the context of what's happened over the past year, moving to the current position, specifically around winter pressures and how we've responded to 2 things in particular: a spell of particularly cold weather and the current lockdown conditions. So the paper explains that, but I'm happy to answer questions. The context in the paper also is important because, as everyone will know, homelessness will be a pressure whatever year we're in, and we've done good work in the last few months around making sure we tie up our response as a council to wider housing needs through the allocations policy to make sure we provide housing for people in need, and homelessness pressures are with us. And the context of the paper is how far that has become more acute over the past 9 months since COVID, and the particular spike in single homelessness and rough sleeping pressures was triggered to a large degree by the Everyone In directive from government in, I think, April, which led to us bringing in an additional 63 people into accommodation. And again, the context is important because many of the members on this call will be aware that's created a double pressure of the need to protect very complex people with very complex needs and occasionally challenging behaviours, to accommodate a range of people, largely from Weymouth and largely in accommodation that is in Weymouth. So that's raised its own pressures to do with balanced communities, as well as making sure we've got the proper wraparound support and intervention where needed. There are particular actions that have gone relatively well, I'd say, around getting into a better position for now and for the foreseeable years, and that's to bid for and gain and get funding to provide accommodation that's more suitable in different parts of Dorset. So again, there's detail in the paper around this, about and we got £1.6 million from government, as well as backed up with some capital money from internally from Dorset Council to acquire properties, and we're on track to deliver another 39 properties to homes, bed spaces, if you like, to accommodate people more appropriately. So that's context, and that was a position where over the course of the certainly recent months, we've managed to reduce the number of people in bed and breakfast from 139 at the peak to 82 at the end of December. So that's been going relatively well. Again, context, because it's relevant to the here and now, is taught us lessons, certainly lessons around how we coordinate between agencies and that includes voluntary sector as well as statutory agencies such as police, health, other departments of the council and local members. We recognise that the need to provide a good response to homelessness demands a lot of different interest groups. So that's again something I'm happy to answer questions on. Conscious of the need to be succinct, I'll jump straight on to particular aspects of winter pressures. Since 29th of December, if you recall, it got particularly cold then. What's called a severe weather emergency protocol was triggered, and in order to keep people safe from that severe cold, there was an action to take in 24 additional people into accommodation. On the 4th of January, an already funded exercise to provide winter shelter was opened, run by the Lantern Trust, and that helped to put a roof over the head of 10 individuals. So those 24, 10 were accommodated in the safe sleep arrangements, and the rest in local bed and breakfast. As you'll appreciate, that created a spike of management pressures, which we're dealing with at the moment. The additional change, which is worth bringing to people's attention, on the 8th of January, Secretary of State wrote to all local authorities to say they expect all rough sleepers to be kept off the streets, to remain accommodated, and the difference between what's been asked for, what's been instructed for now, and what happened in April last year was that it's focused very much on people who are out, not people at risk of rough sleeping. So it's a smaller number. But that does mean that those 24 or so, or up to 30 or so people, we have a duty during the period of the winter to keep accommodated. Numbers wise, I've mentioned we got bed and breakfast numbers down to 82 at the end of December. They're currently at 94. So it's not a single, just to be clear to everybody, that's not a single bulk of people who stay in bed and breakfast. It's basically people being moved on and new people moving in. But the net position is 94, which means we're still working very hard to move people into more settled accommodation or more appropriate. And we have accommodation around the county, Swansea Youth Hostel, Portland Youth Hostel, and other pieces of accommodation where we do move people on. Last thing I'll say before opening up to questions, around the continuing work, the joint work around agencies, bringing agencies together, we've accelerated since the Christmas period, and we now have weekly liaison meetings with police, community safety, voluntary sector, to make sure we're keeping tight on the balance between support needs and community pressures. So that's happening. And we will offer equivalent meetings with local Dorset Council ward members and town council members as well, something that Graham Carr-Jones and I spoke about only this morning. So that's to make sure we've got that communication tight and the joint working tight. Some good news to announce, which will hopefully get some press. The joint work leads to bids for grant funding, and we've managed to get some £300,000 through joint work with public health and voluntary sector agencies for some drug and alcohol support for rough sleeping, which will be announced in the next week, I'd say, and something we would have available for next year. So it's particularly helpful to make sure we've got some wraparound support for the more complex needs individuals dependent on drugs and alcohol. I'll probably leave it there, Councillor Taylor, as you want me to be brief.
Thank you very much, Andrew. That was really useful. I seem to have an echo. Is anybody else picking up my echo?
Yes.
Andrew, can I just? Oh, that's better. It's gone. Could I just briefly pass over to Councillor Carr-Jones just to see if you've got anything to add at this point?
Thank you, Chairman. I think Andrew's given a very succinct position of where we are. I feel that with scrutiny, it's always better to listen rather than talk, I'm here in listening mode to see what your members say and to take away anything that comes up on offer, but always happy to answer any direct questions if they come up. Thank you, Chair.
Thank you very much, Councillor. Can I go over to the 2 questions that we have from councillors then? Could I ask Councillor Barrow to read his question, please? And I don't know who was going to read the answer to that. I'm happy to read the answer, or go on, I will read the answer to it.
I think it was you, Jill.
Thank you.
Thank you, Chair. Are you ready for me to start?
Yes, please, if you could. Thank you. And thank you for coming this morning.
No, it's been very interesting. As we are all aware, housing homeless residents in Weymouth seafront hotels during the first lockdown led to a number of issues. The most serious being a significant rise in the frequency and nature of antisocial behaviour, which had a very detrimental effect on local residents. Dorset Council's reliance on using bed and breakfast and hotel accommodation meant there was no alternative to using the small number of bed and breakfast stroke hotels who actually offered accommodation. And as these were in Weymouth seafront, this led to a concentration of issues in a very small area. There is now a welcome move to providing in-house accommodation to reduce reliance on bed and breakfast stroke hotels and to provide accommodation nearer to residents' home locations. In order to understand how effective this might be, it would help to know the following. How many bed spaces does Dorset Council plan to have available? When will the bed spaces be available for use? Where are the bed spaces to be provided? And what type of accommodation will the bed spaces be provided in? Are we looking at hostels or shared houses or self-contained flats, etc.? So that's my question. Thank you very much.
Thank you very much, Councillor. And the written answer that I've been given to this is, as acknowledged in the question, there are considerable efforts underway to provide a better balance and spread of accommodation to house homeless people. Short-term emergency use of bed and breakfast accommodation is still suitable in several situations, but it is recognised that placing a high number of people on or close to the seafront in Weymouth can put undue pressure on the area. This is a lesson we have learned from the summer of 2020, where there was an increase in antisocial behaviour linked to the higher use of B&B accommodation. As outlined in the report, there is disproportionate level of demand from single homeless people for this type of emergency accommodation, with particular acute pressures linked to those who have been sleeping rough. Balancing the location and type of provision is recognised as important. A successful bid was made to the government's Next Step accommodation programme in 2020, which has provided 1.6 million for this financial year to acquire properties and provide linked support. A combination with additional council capital funding, this is on track to provide temporary housing for an additional 39 single homeless people. These are being provided across the Dorset Council area. It includes one scheme at Bolwood in Bridport, which will provide accommodation for 7 people this financial year, and the plan to provide a further 7 next year. It includes a scheme run in partnership with the Bus Shelter Project to provide 10 temporary pods to accommodate people who have been rough sleeping. The property acquisition programme is acquiring properties across the Dorset geographical area, include areas such as Wimborne, Blandford and Bridport, as well as Weymouth. Of the 39 bed spaces, 24 are in self-contained flats, 5 are in shared flats and 10 are in self-contained pods. We intend to bid for further government funding as part of the planned 21-22 NSAP programme. So that is your answer, Peter. Are you happy with that, or would you like to ask any supplementary questions?
No, I think that's a good answer for now. I mean, having been heavily involved in liaising with residents during the antisocial behaviour that was going on during the first lockdown, I just cannot overemphasise how badly that affected the locals. It was awful, and we've just, and I fully appreciate lessons have been learned. We're making some really good steps, but please let's keep going and let's make sure that what we do is effective. Thank you very much.
Okay, Graham Carr-Jones, would you like, sorry, Councillor Carr-Jones, would you like to speak on this one at the moment?
I just wanted to very briefly acknowledge what Councillor Barrow said, and said that, I mean, clearly from what Andrew Billany's report said initially, and response to his question, I hope members can see that we're doing an awful lot. I don't like the expression lessons learned, but we're certainly, we've learned a lot in the last 12 months. Thank you, Chair.
Thank you, Councillor Carr-Jones. I've got Councillor Rennie wanting to come in. I'm not sure whether you want to come in before the next question. I think I would like to take the next question unless your question is urgent, please.
I was really only going to ask, because Fiona's commented to my comment, the question and the answer is going to be sent to us. But as other parts of the council area have been mentioned, I think it is a good idea that all councillors see the question and the answer, because other areas that councillors represent, were mentioned as where the accommodation is going to be. But I can leave that with you. I don't expect an answer, Jill.
Yeah, thank you, Councillor Rennie. We'll give consideration to sending this out to all councillors. The second question is from Councillor Howard Legg. I don't know who's going to, could you read this out, please, Councillor?
And I've got that
Rennie,
one.
thank you.
I wish to respond to the invitation to members at the end of agenda item 7 to respond to the report on homelessness during the winter. Since I will not be attending the meeting, could my comments be made available to attendees? There are comprehensive details given about government support and expectations with regard to numbers of people sleeping rough and what offers of shelter that must be made to them. There is also a list of charity groups that the Dorset Council works with in implementing the requirements triggered by cold weather, plus the COVID situation. But both the report and the email fail to advise councillors what accompanies the provision of shelter. Many of those people bring problems with them that need assessing and acting upon. Assessment and solutions will consider a variety of situations, including occupying the rough sleepers homeless during their waking hours, making sure they stay safe and preventing antisocial behaviour. Their overall well-being needs to be considered, and not believing the council's job is done in providing them with just a roof over their heads. Providing a security guard when local residents complain is of no benefit to the people who are being helped. Both reports neglect to say what the council will be doing, and neither goes into much detail of what our partners will be doing either. I would like to be informed how the council is adopting a holistic approach to this situation and to be informed of it.
Thank you, Councillor Rennie. The answer I've been given to this question reads, the need to provide a holistic approach to deal with such complex challenges is understood and accepted. The current response to the rise in pressure relating to rough sleeping and single homelessness involves close liaison with broad partnership across the council, charity, housing, health and police sectors. This also extends to the funding that has been brought in to provide housing and associated support for people affected. For example, the Next Steps Accommodation Programme funding from Government MHCLG provides £283,414 to fund a range of support to people currently accommodated in Swanage and the Portland youth hostels. Housing management services at Swanage are provided by Stonewater, and support on both sides is provided by the Lantern. The bus shelter project is funded directly to provide support for the new proposal to house 10 rough sleepers in newly provided pods in Weymouth. Julian House has been funded to provide a service and a worker to develop health pathways for women who are vulnerable and sleeping rough. This provides some headline examples of what is being done to support people in this position, focusing on the voluntary sector role. There is also close liaison across the public and statutory sectors, with weekly police, council and voluntary sector liaison on community safety questions. There is also close collaboration across the health and social care agencies, including a newly won bid to provide support for people with drug and alcohol related support needs, with details being prepared. It is recognised that this is a very vulnerable client group, so further schemes and bids for funding will be a feature of the years ahead to plug gaps in support and enable more settled lives. Regular member and community updates will address this question in future issues, recognising that there is a lot of detail which cannot be covered succinctly in answering this question. That is the answers that we've had to the two questions from councillors. Sorry, I'm just checking the chat bar. I'm just going on to the committee questions now. Could I call in Councillor Orell, please?
Thank you, Chair, and thank you, Mr. Billany, for the presentation. First, to acknowledge that there has been excellent work by the council in getting people in, which in the past, a few years ago, before there was a lot of this council action, we used to see about 4 or 5 deaths a year among the homeless in central Weymouth, people freezing to death in toilets, pretty poor in a rich outcome in a rich country. And we've, for all its faults, this scheme has brought people in and got them, many of them, helped. The problem came, as has been alluded to by Councillor Barrow, and for understandable reasons, too many people concentrated in a small area, and you can see the argument. They come to an area where there's more services, fair enough, but the effect isn't additive. It was a multiplier effect, because in the same street we had some sort of houses of multiple occupation and housing associations providing beds for particularly high need individuals, and when they all came together they kind of fire off each other, and this is the problem of having too much of a concentration in one area. So very pleased to hear the reply to Councillor Barrow's question that there's going to be more of a dispersal and that the whole county will be helping. It's claimed that many of these are Weymouth residents. Well, they kind of become Weymouth residents. They're moved to Weymouth because it's got the cheapest accommodation for a few months. They somehow become Weymouth residents. Most people have actually come from other areas, so it's good to hear that there'll be more of a spread. Particularly like the replies to Councillor Howard Legg's question about supporting the day. We may see later down the agenda the community safety report, the public health protection, public protection orders, protecting antisocial behaviour from alcohol is one approach, putting people in prison, but that's not the greatest approach. The better one is getting the help and support. I was slightly perturbed that we had a bit of an uptick in reports from residents about 3 or 4 weeks ago, but hopefully that was just a blip, and the measures that we've had in response, particularly with the to Councillor Barrow's and Councillor Legg's questions, means that has been noted. We will be informed as local councillors, and these actions will help. So I hope that is the case.
Thank you, Councillor Orell. That was really useful, and I think the information given to councillors and to the public is crucial to this, and I do welcome the responses that we had to both your questions. There's a question I want to ask, and I'm just picking up on Councillor Legg's question and answer, which is around the holistic approach to homelessness and to rough sleepers in particular. And I often think this is probably an absolute function of scrutiny. I look at this paper, and this paper is absolutely brilliant, don't get me wrong, and I'm not in any way criticising it. But it's a council's view of what we're doing with homelessness. I would really, really like to talk to some of these agencies and get their views of what we are doing and looking at how we can possibly work more effectively. We've heard an awful lot about the cross-working and the meetings that are going on. And I think we all have lots of meetings, but I think scrutiny could be an option to just step back and look at what we're doing, look at the agencies and saying, are we actually getting this right? I think it's fair to say, and it has been alluded to, that we didn't get it right last year. And certainly I was getting bombarded with emails along with other members. It went the way it did for reasons that were to some extent beyond our control, could have been foreseeable, but we were in the middle of a crisis, we reacted to a crisis, and it's the acknowledgement, I think, that we did a lot right, but we didn't get it all right. And I think going forward, I think it might be worth looking at the sort of more of the holistic approach to rough sleep. Are we getting it right? Are we making the best use of what we've got? If we had millions of pounds, we could solve this. Though that is goes without saying, but we don't have millions of pounds. So are we making the best use of what we've got? Are we making the best use of all the organisations that we work with? Or could they say to us, well, if you did this, we can do that and work better together? So it's just something I'd like to throw out there for discussion at the moment, whether we want to do a little bit more work on this or whether we are happy with the response. I don't know whether anyone's got any suggestions or comments on a view that we may want to do a little bit more work on this. Molly, sorry, Councillor Rennie, would you like to come in on this?
Under normal circumstances, we would be having our homeless forums, and in the room, people would be sitting together and be able to interact with each other better. But we're not in normal circumstances, so it's no good me going backwards to that. But could you not investigate a one-stop scrutiny, there's so many names for it all, a talking shop, a focus group, anything whatsoever, whereas people are brought in to give that discussion and that openness that you can have a conversation together in a relaxed atmosphere of this sort of meeting, but feeling that they're not coming to be got at. Just the fact that everybody's sitting together in a room might be helpful. And you could lead the questioning to find out. I reckon that we'll find out that they might say, do you know, if we could do that, we could do that as well. Two people sitting together might make a suggestion of where their money could be better placed and their time and resources could be better placed. I'm not talking about a full in-depth scrutiny, and I'm not talking about something that takes all day.
Thank you very much, Molly. I think for members of the committee, there are a number of ranges that we could do. We're either content with the report and that is the end of it. We could ask for a second report to come back at some time. We could ask for what Molly has just alluded to, which would be a half day just sitting around the table, talking with agencies working in this field, or we could ask for a full-blown scrutiny where what used to be called task and finish but was often called task and never finish. I think we have to be proportionate to what we're asking for and also very mindful of officers' time at the moment, because COVID has put an enormous amount of pressure onto our onto our officers. Could I just bring Councillor Carr-Jones in? I don't normally ask for a brief holder at this time, but I think he's probably wanting to talk on this issue.
Thank you, Chair. Yes, RTS request to suggest, perhaps. I think it might be interesting for members if I was to work with yourself and Andrew, perhaps to put together for late autumn an event whereby we talk to people, bring people like Lantin, you first into the room, and have a kind of a bit of a not a deep dive, but a dive into to letting members understand more the work that's gone on around this, because it has been complex. I mean, I know people were saying we might have got things wrong, we might have got, but in fairness, we didn't really know what was right and what was wrong pre the pandemic. We were just told to do, and we did. And perhaps come late autumn, you might have a half day together with some of our partners. That's just a wee suggestion there, Chair.
Thank you very much. I've got John Orell coming in on the chat bar who is saying that he would like a little bit more work done on homelessness. Could I just ask, John, are you talking about homelessness generally, or are you talking about rough sleeping specifically?
It kind of moves into another, but concentrating more on rough sleeping, I suppose that's been the most acute problem for us. But we can't solve that without solving the general problem. But yes, I like Councillor Carr-Jones's suggestion. I'd rather have it in the spring rather than the autumn. But that kind of half-day session suggested by Councillor Rennie would be a good way forward. Thank you.
Thank you. Could I bring Councillor Rennie in?
Yeah. Yes, I like John. I like the idea of it sooner rather than later. I was very taken with John Orell's comment at the very beginning of the meeting in the chat bar, where he talked about if we leave it till everything's over and done with, we've missed the opportunity to get something right that might be just slightly wrong before something goes wrong with it. I think that the groups that we work with have probably sat around as well and said, if only we'd done that, if only we'd done that. And because at the beginning of last year, we had to react very quickly to a crisis we'd never seen before. But now there can be more considered views about how we do things, and I suspect there has been more considered views. But I think if we left it to the autumn, that would be lovely, because then we would know what we've done. But if we left it till the autumn, we haven't got chances to just tweak things that we may have. And that's what Scrutiny is about. We can invite partners. We can invite anybody we want to come and have a chat with us. It's a good way of working. And I'm pleased to see that John was keen with this idea as well.
Okay, thank you very much, Councillor Molly. I think we've got a way forward on this part of the paper, and that is that we are going to set up a working group to look at this. Could I ask, do we have general agreement across the committee that this is a good way forward on this part? I haven't finished on this paper yet. Does anyone, or actually rather, does anybody disagree with it being a good way forward? Okay, I've got nobody apparently disagreeing. I've got a couple in the chat bar that are agreeing. I'm going to have to ask for a working group to be set up. So could I ask for volunteers for the working group, please? I would like to go on it for one, so I'm going to put myself down.
I would like to go on it.
Molly. John.
I would like to go on it. Jean.
Jean, brilliant. Thank you very much, Jean.
Thank you. Thank you.
Thank you. Do you have any comments to make on this paper, Jean? Sorry, Councillor Dunseith? Because Weymouth is relatively close to you as well, where all the issues were. Did you have any problems over in Chickerell? I think Jean has gone away again. Okay, thank you. The other thing I would like to suggest is that we may want to co-opt one or two. Sorry, Jean, you're back.
Sorry, no, everything went off. I do apologise. No, I did notice an uptick in homelessness or planned evictions or people generally having to lose their settled or temporary accommodation that I was involved in. There was an uptick there, but not rough sleeping. No, I haven't been involved in that at all. But I do think it is a very good paper, and I am aware of the problems and the numbers in Weymouth and the problems that putting so many people together in a relatively confined area in such a short space of time, although you were fulfilling a need in that they were having a roof over their head when they needed it, and it had to be done very quickly. I am aware of the problems, the social problems and the antisocial problems that followed from that. But no, Chickerell was not, as far as I am aware, involved in the homelessness, but the housing, yes. Thank you, Chairman.
Thank you very much, Councillor Dunseith, and thank you for offering to come onto this working group. I think what I would like to do from the working group as well is probably extend it to local members who were most affected by this and invite them to come and join should they wish to. With regards to timing, we've had talk about autumn. I think, can we take this offline, please, to talk about, because I think we don't have problems with rough sleep in the same sort of way in the summer as we do in the winter. And I think the autumn may be too late, but I'm happy to talk with the portfolio holder about this and bottom out the date of it. So we've got one recommendation. If we can move on from this part of it now, I've got another question coming in from Councillor Legg, who's asked to speak later. Could I go over to Councillor Legg, please? This is Councillor Robin Legg, not Councillor Howard Legg.
Yes, I imagine people at the beginning of the meeting might have thought I've been very busy writing letters as well. And I think actually when you come to read this paper, it illustrates some of the issues which arose on the previous item, which is monitoring what's going on and trying to make sense of it. And what struck me listening both to the explanation given by Andrew and also I think probably I feel a bit punch drunk having read both this paper and some of the cabinet briefing papers which had preceded it. There's a very sort of uncertain and movable number of data points about rough sleepers. You know, that what's true this morning may not be true this afternoon, and certainly isn't going to be true tomorrow. And therefore trying to make sense of what was happening through reading the paper was a little bit difficult. I think the answer given to Peter Barrow's question was very illuminating. And I think it would have been helpful if some of the information about accommodation that was being purchased and provided for people who are homeless and for rough sleepers, it would have been helpful if that had been presented in the paper in a fairly simplistic way without going into great detail. And also on the financial side, it's clear that we've got quite a lot of payments received from the government to help with specific elements of rough sleeping and homelessness. But I wonder whether one of the officers might be able to give some guidance about discretionary housing payments, because I understand that the government fund the authority, along with every other authority in the country, to allow them to make discretionary housing payments. And I'm just wondering what we receive by way of that kind of finance from the government and how we spend it, and is it available to making provision to stop people becoming homeless?
Can I bounce that question either to Councillor Carr-Jones or to, well, initially, could it go to Councillor Carr-Jones?
It could, Chairman, but he'd struggle to answer the question on those discretionary housing payments.
Shall I sorry to jump in, shall I briefly, because I think it would have to answer Councillor Legg, because the short answer is yes, we do make use of it to prevent eviction and prevent homelessness, but I think it'd be helpful if I could provide you some breakdown of how that's spent. So discretionary housing payment funding is a tool in preventing homelessness. Yes.
Yes, I apologise for just sort of bouncing in with a detailed question, Chairman. I wondered if I was to send you an email, Andrew, whether that would be helpful, and then maybe it could be circulated amongst members of the committee.
That would be very helpful.
Happy to do that.
Thank you.
We'll do that.
I think that raises an interesting point, which I don't know whether Andrew can answer. Do we have policies around how the discretionary housing payments are made? Who do? Well, I know who we make them to, but do we have policies around who they're made to give officers guidance on this?
We do, but I think it would help if we could maybe get this into either the next briefing or a direct response to the email that Councillor Legg's going to send.
Okay, thank you very much. I think we're just about there on this item. The recommendation was to comment and respond to the requested updates. So I think as a response to that, we've got a recommendation or a decision that we're going to set up a focus group sometime in the summer to look at the holistic approach to homelessness. There's a comment in the chat bar looking also at the projected spike in homelessness as we go into increased evictions as a result of COVID. So I think this is a very COVID related one, but it's also the wider issues and the ongoing issues of homelessness. I've also in the chat bar been asked by Councillor Barrow if he can come onto the working group, but I will extend that, which is great, and thank you very much, Councillor Barrow, but I will extend it to other members in the area who may want to take an interest and come along to this. So we'll take that action away and the working group will be in touch. We will be in touch with the working group. I suggest at the moment that if we take it offline, and I'll talk to Councillor Carr-Jones and also Andrew about how we're going to scope this and take this forward, and then we'll come back and have a really short scrutiny investigation into it, which we'll report back to this committee. Thank you very much. If we can go on to the next agenda item now, which let me just turn my pages over, which is the community response during COVID. And if I can ask for, I think we've got Claire Shields in the room. If she would like to very briefly present this paper, please. Are you there, Claire?
I'm here. Thank you, Councillor Taylor.
Thank you.
Good morning, everybody. I'm Claire Shields. I'm the Corporate Director for Commissioning, Quality and Partnerships in Children's Services, and have the pleasure of presenting this paper, which is around the Council's partnership response and how we've worked with the community and voluntary sector to respond to the increasing requirements of us as a council through the pandemic, but also how we've worked together to build on that to meet emerging needs. It's a unique piece of work really because it affects all bits of the council and all parts and all directorates have been involved in putting this work forward. So trying to pull together a report of a wide range of work that we've been engaged in and where we've initially set up to respond to quite a specific ask around meeting the needs of shielding residents. The work has grown and continued throughout the response to the pandemic. So I really wanted to draw your attention to the critical and really valuable contribution that the voluntary and community sector has made all through the pandemic, both in focusing on direct provision to shielding residents, but also the increase in needs that we've seen emerged around financial hardship and around food security. You can see how the partnership stood up new services and support, and you can see the types of support that we have offered. Particularly noteworthy is the volunteer matching service and befriending service that has been set up, which has really helped think through how we support our more valuable residents, but also thinking through how we've moved to take on the delivery of food support to shielding residents when the national government scheme has ended. There has been huge generosity from local communities, elected members, local residents and local businesses in making sure that we keep families from being hungry, and that is an ongoing part of our work as we continue. We've learned some really good lessons as we've continued through this work. So we know that personalised and local responses has worked really well. The challenges for that in that for us has been how to coordinate that, and we know we've not always got that communication right at the start, but we've been growing and learning lessons as we go, and we'll continue to do that as we move forward. We know that having a place to record and centrally see who's working on different things has enabled us both to connect people together to avoid duplication, but also to spot emerging gaps and think about how we can work together to plug those as we go forward. I think one of the key messages for us has been around local communities know themselves well and know what they need and not getting in the way of that. It's a really important message for us of how we do that. And then thinking through how we can support our community and voluntary sector as we move into the future. We know that for some funds have been directed towards COVID responses more generally, and for community and voluntary sector organisations that haven't been involved in that, access to external funding has been a challenge throughout this period and will continue to be a challenge. So we're working about how we can work with our infrastructure organisations to provide that support as we move into the future. So an amazing piece of partnership work across the whole sector, lots of generosity, lots of work to continue, and really thinking through how we can direct our financial support and the Council's infrastructure support into the future as we move forward. I think that's probably enough. There's a lot of detail in the report. I'm happy to take questions.
Thank you very much, Claire. I've Councillor Miller has come into the chat bar and asked to speak after Claire. So if I can go over to Councillor Miller, please. She is the the portfolio holder for adult social care and health.
Thank you, Chair. That's really kind, and thank you for indulging me. I realise fully that this is a scrutiny meeting, it's not the Oscars, but what Claire can't say is that she has led this piece of work so calmly and capably that, you know, it really has been quite eye-opening and at times quite emotional for me to be one of the political leads on this. I think the response from our community partners, the response from our communities has been absolutely incredible, and just leading on from this piece of work, I'm leading a stakeholder group for our transformation in adults, which is made up of our partners from the community and voluntary sector who have worked with us alongside us as partners throughout the COVID response. So just to give you an illustration that this work has been a really, really valuable response to a horrible situation, but some good, long-lasting good has come of it as well, and they're really engaged, and we're really pleased to be working so closely together. But you know, I just wanted to say a huge and personal thank you to Claire and all the team that have been involved with it, because it has at times been very relentless, and it has at times been very difficult. But I think the report stands as a really good reflection of everybody coming together, and so I commend the report. Thank you, Chair.
Thank you. The first one who's coming to speak is Councillor Pipe. Could I go to Councillor Pipe, please?
Thank you, Chairman. And I echo what Councillor Miller has said about the way that Claire and her team have managed this this pandemic. It's over and above, and you have my very grateful thanks for that, Claire. Dorset, of course, has followed government guidelines in relation to COVID pandemic. This is not to say that Dorset Council hasn't introduced their own initiatives outside of government guidance. I think initially the setting up of local response groups to help the most vulnerable in our community was patchy at best, but as Claire said, that moved on, and it was coordinated by Dorset Council through Dorset Volunteers. You know, by lockdown on the 23rd of March, a lot of local councillors had formed embryonic groups to support residents. Dorset Council in most cases funding these groups and with funding from other sources such as SSE and the like, and they enabled these support groups to thrive, which is good. I think everybody would be grateful for the money that they have received from Dorset Council on this. I think the sorting of PPE by Dorset Council was, I believe, as good as any council. You know, with all joining the bun fight in trying to obtain appropriate and fit for purpose PPE, you know, I think they did really well. You know, as with all unknowns, lessons are learned, and as Graham said earlier, that's not something I like to repeat. You know, we all learn lessons as we go on through life, and Dorset Council, I think, was ahead of the curve in strengthening their response by going back to see where they may could have done better or been stronger. Now, NH staff, GPs and volunteers and other health professionals have worked together in preparing for the rollout of the yet unavailable vaccine. But on Friday, the 15th of January, in my local area, we started rolling out the COVID injection down at Poole Docks. Now, by all accounts, from members of the public, I've been there on I think I've had 3 days off since the 15th of January down at Poole Docks, and the overwhelming response from people who are going through at that time, these are people in their hundreds, their 90s, their 80s, has been one very positive experience, you know, from those, you know, as evidenced by letters to the Bournemouth Echo and like. And I would like to say that the health professionals, Dorset Council, the voluntary sector, of which I'm part of, they have gone over and above what I believe would be taken as a normal day's work. They've been absolutely fantastic, and I applaud every single one of you. That's the end of my rant.
That's not at all a rant, Councillor Pipe, and I would wholly agree with you. I think our volunteers have gone over and above and are absolutely amazing. And I would like that fed back to them, Claire, that from this committee and from councillors. I think councillors across the board would agree with what Councillor Pipe has just said. I've got Councillor Rennie coming in, please.
Likewise, I would like to also say this, but I'm not going. I think one of the biggest pieces of work done as we've moved further on from the lockdown initially at the beginning was the work done to join people up, and the work that has been continuing to be done to help those individual and those very localized support groups to come sort of under the umbrella if they wanted to, because people working individually are not going to have that capacity when they go back to work or when they get tired. We just don't know what's going to happen as this year goes on, and I think that work done to sort of wrap our arms around everybody to bring them in to help them help other people has been amazing, Claire, and that work is good because it's about enabling residents to be able to help themselves as well. The number of people now who realise you can have your prescription delivered from the chemist along with anything else that you might need, and also that chemist is managing your prescription and knows when you need more. I think that's just talking to people, that sort of thing, the enabling role that you've helped people to achieve, again, deserves a huge pat on the back.
Thank you very much, Councillor Molly. I think, sorry, Councillor Rennie. I think
Councillor Molly.
I think I'd like to come in now, and I'm not negative. Well, I am at times negative, but we are actually here to scrutinise. And I think something that Councillor Rennie has just said is really interesting, that residents can have their prescriptions delivered. The question I would ask, and I've spoken to my local chemist about this, is how much are they actually funded to do this, or how much are they doing it out of their own funding? Because if I remember right, when I was talking to my local chemist about that, they weren't funded to do this. They're doing it as a service out of their own pocket, which actually brings me on. Oh, I've got an RTS in from Claire, so I think she's probably got the answer to my question there. Do you want to come in, Claire? Because I haven't primed you about this question.
No, happy to. Two different things happening. So in the first place, where we can, we're matching volunteers with residents so that they will go and pick up a prescription where they can. There's a second ask of community pharmacy to be able to provide free prescriptions specifically for residents that are shielding during periods of lockdown, and the pharmacy contract has now been changed to be able to fund that. So there's two asks. So one is particular asking pharmacies to do it for shielded residents. The second one is around matching volunteers to people that either don't want to go out, are self-isolating, or are shielding, and that's been really, really successful. We've been matching them up through Volunteer Centre Dorset and others to be able to do that for people.
That is very useful. Thank you very much, Claire. I think my other point I would like to make is around capacity, because I'm a great one for doing back of a fag packet bits of maths. And if I look in my ward, I'm just looking at the food insecurity part of the paper, and as members, we had an excellent presentation on this earlier on this week. But on the back of a fag packet, in my ward, when I'm looking at the amount of people who are likely to be on universal credit, from my ward, you're looking at round about probably 450 people. And if the entire cohort from there felt they needed to come to either the Nest, which is in my ward, or the food banks, that would be totally swamped. And I'm just wondering about capacity going forward. I'm also wondering about the numerous people who will be what I call the just managing, who are going to increase in numbers in the near future, with the potential for the £20 uplift on the universal credit being cut in March, the potential for the benefits cap kicking into a lot of these people who have been on universal credit now for several months. And it's just the around that, the capacity, and how we're actually planning for the capacity, the increase in the need, and getting our information out and getting to these people who really need it. My feeling is there will be a lot of families around who are just managing, who actually could manage a lot better. And I worry particularly about the youngsters involved in this, because we have got stuff in place for free school meals, but what's the take-up like? And how often do you hear from residents, I'm not prepared to apply for benefits because I'm too proud to do it? I don't quite know who, I think Councillor Miller may want to comment on that.
Hello, sorry, I was just adjusting my headset. Yeah, absolutely, Chair. Laura's fine. And I think Claire probably wants to come in on this as well, perhaps with some more of the detail, but you mentioned our food security workshop that we had earlier this week, and part of what we're driving for at the moment is really to move communities into a place where there is not that immediate food banks sadly exist where people have no food and have an immediate need for food. What we want to do is move people and move communities into a place where they have choice, they have control over their food budget. There is no shame attached in going to some of these resources, and I particularly like the concept of community fridges, and to I feel very passionately about food waste, especially from big supermarkets, and I think it is beholden on us as community leaders to move things into a place where we are actually looking at the environment, where we're looking at we're all involved in a collective effort to ensure that food doesn't get wasted. And I think that in its turn then is very helpful for people who are experiencing food poverty, because they are not stigmatized by using those services. They're for everybody to use, and it's a collective effort to improve and reduce food waste. So that's one side of things, and actually, we're doing a lot of work with our partners about how we move communities into that space. You were in the briefing, and some of the stuff that was going on about food workshops, when things like that can be permitted again, can take place again. How we reduce food waste, how we repurpose, how people can buy into schemes like the Pantry, like the Nest, where they pay a small fee but they can actually do more shopping and get more for their money. So there is a huge amount of work ongoing, and I think it might be appropriate in the future to bring something specifically back to this scrutiny committee on the food insecurity work that's happening, because I think that probably is an area that will deserve more exploration. So I'm happy to look at that in the future, Chair.
Thank you very much, Councillor Miller. I've got Claire is asking to speak. I don't know whether you want to come back in at the moment.
Yeah, it'd be helpful just picking up a little bit of detail on things we're doing to both understand future demand and impact on people. So as part of our work, we've got a wellbeing subgroup who's mapping need and trying to identify where we can provide some additional support. And that's part of our work going forward. Just specifically around families, we have had some support from the Department of Work and Pensions to administer a winter pressures grant, and we've identified families that are eligible for free school meals and have been supporting them throughout the pandemic, but also providing support around utilities. Our take up of free school meals and applications actually has increased during the pandemic, but also we've reached out to schools to say, these are families that we know you're concerned about. Can you tell us who they are and how can we get some support to them directly? So we have increased the offer to some families that we know are facing hardship, and schools know are facing hardship, to be able to offer them some additional support throughout the winter pressures. But we don't underestimate the potential impact of financial hardship. So working with citizens' advice to be able to offer support around a whole range of financial opportunities for them and taking up benefits and making sure they're accessing everything they need to get more financially secure, in addition to dealing with the emergency need of food support as and when it arises. So quite a bit of work within the sector, and particularly grateful to Citizens' Advice for stepping in and increasing their capacity to be able to provide support.
Okay, thank you. That is really useful. I think I've got another question around grants and the grants that we have coming in. That I had a little chat with you yesterday about that, Claire, and what grants we get in, because an awful lot of this work is based on the grants that we get in for our communities, and the grants that we actually give out from our own council funds to our communities. I don't know whether Claire would like to comment on the grants and the situation with grants, because we're obviously in competition with everybody else from across the country. And although there's a lot more release from government at the moment, but also I've certainly experienced in Weymouth an issue where people aren't aware of grants, and I've been pushing grants out as fast as I can. But it's that sort of aspect. I don't know whether you would want to comment on that, Claire?
Yeah, happy to comment on that, Councillor Taylor. So we've had some specific grants that are COVID related come through. So we've had a DEFRA grant around access to food, and that's the money we've been using to support food banks and others, and the food security work. We've also had the Winter Pressures grant that I've just mentioned, which we've been working directly to support families, but also some other people and some of our support organisations. And we've had additional government grant around support and shielding people specifically. So that's some of the work that we've been using to build capacity within the infrastructure sector. We also have our own grant given programme, and I've linked to that in the background papers, which was agreed and signed off by Cabinet, about how we choose to spend that money and how we focus those priorities. So worth having a look at that and thinking about how we may want to revisit that to see if we're getting it right. And as part of the work of the community response group, we've agreed to work with Dorset Community Action to make sure we're getting better at pushing those grants opportunities out. So what we've noticed is there are a lot of grant opportunities coming through, but they're very short windows at the moment, and if you're not looking out for them, you may miss those opportunities. So we've asked the corporate grant team, so Laura Cornett's team is working with Dorset Community Action to see if we can get better at pushing those out, keeping an eye on them and providing some support to groups actually to be able to access those, because we know the window and the turnaround of those is quite quick. So that's an active piece of work they're working on at the moment, and probably one that we would want to talk about over time and maybe have a conversation about that in the future to scrutinise how we're making that work and if we're having the impact we want.
Thank you very much for that, Claire. I don't know what the rest of the committee is thinking about this. What we've got at the moment, Councillor Miller has offered to come back at some time and give us an update on food insecurity, which I think will be very useful either as an information item which would be circulated prior to committee and not for discussion, or whether we want it as a discussion item on the agenda. And we've also just had a comment there from Claire that she thinks some future work on grants and how we give grants out, how we advertise grants, how we help organisations when there's a very short turnaround with grant applications coming out and the applications needing to be going in. Could I have some comments from the members of this committee as to how they would like to take this forward, please? I'm quite happy to put both items onto the agenda for forward planning, but then it's a case of how important are they to come forward, say this year, this summer, this autumn, or next year. I need some guidance from the committee, please.
Well, I was holding back to wait to see if anybody else said something, but they didn't. So I think the food security is really interesting. It's exciting. But we had the briefing and members were able to go to the briefing, and the briefing is there online now, I think. I'm assuming it's going to be online. And so people could see the briefing. And then we could decide if, because I don't know if everybody's managed to see the briefing and be involved with that. And you always talk about what are we going to achieve by having something on an agenda. And I don't know that we would, but I think the grants, if Claire feels that we could give her some added value by a couple of members talking together about how that would help her. Again, it's a bit like a short focus group that you're talking about with Laura or somebody. The turnaround on grants is so quick and you can send them out, you can scattergun approach, but when you send them, you don't know when that next organisation is going to send them further. And so often you miss the short window for something. And Claire's nodding, and I'm wondering if she feels that that may be of some use to her. She's nodding.
Okay, I think based really on we've also got it into the chat bar that Claire would welcome that, and I think that would be a very useful use of scrutiny. I would need some members to take this offline and take this forward. Now, are there any members who want to take this offline and take it forward? What we're looking at is a small piece of work at the moment, or do we want something coming back to committee for discussion on grants, which would probably almost be a review of the grants paper and a little bit more to it? Please, somebody out there talk to me and tell me what you want from this. So
I know
what I'm
I suggested it, but I'm not going to put myself forward because I've got another suggestion coming up in the community safety paper.
I would be struggling on capacity myself to take it on. So I am relying on some of the other committee members to come forward for this, please. Okay, at the moment, I've got nobody stepping forward. So I think, could I take this offline, and I will have a chat with Claire later and work out how we're going to take this forward. So I think it's something that we can put onto our forward plan as something the committee would like to look at, which is grants. And I'm just wanting to check that Fiona has got the basis of that for us to go onto the forward plan.
Yes, I have, Chairman. Thank you.
Okay, and I think with reference to Councillor Miller, I think we have enough at the moment on food insecurity, but it is something that we will keep an eye on and may want to come back to at some time in the future. And I think that probably concludes that item. Okay, thank you very much, and thank you officers who've been in on this, and thank you to Councillor Miller for coming this morning. If I can move on to the next item, which is the community safety report. I am concerned a little that we are getting a bit behind schedule. We're about half an hour behind what I was anticipating at the moment, but I think we're doing fairly well. This is a report that comes to us from Andy Frost, and the brief holder, so the portfolio holder for that is Councillor Carr Jones. Well, how I'd like to take this report is it's a fairly lengthy report, but it's sectioned, and I think it might be easier if we take this one a section at a time, because the sections are very diverse. So I think if we can go over to Andy to introduce the first part of this report, that would be really useful. Then we'll take questions, and if there's no questions, we'll go on to the second part and work it that way. Thank you.
Okay,
So
Chair.
if I can transfer to Andy, that would be great. Thank you very much, Andy.
Thank you, Chair. So the first section of the report is looking about progress against our community safety plan. So for those members that aren't aware, Dorset Council is responsible for working with partners to tackle crime and community safety issues. And we do that through the Dorset Community Safety Partnership. And community safety partnerships must produce 3-year community safety plans that are reviewed annually. And our current plan runs from 2020 to 2023. The priorities that are in that plan are set out in the report. And they are determined by using an analysis of data and statistics and public consultation. And although the first year of our current plan's been dominated by the need to respond to COVID issues, we have continued to deliver against those areas and those priorities. And the examples of that are included at 11.8. So hopefully that's a very, very brief introduction to that part of the report, Chair, but happy to take questions and comments.
Okay, I know Councillor Pipe wants to come in at some part, so I don't know whether you want to come in, Councillor Pipe, on the section about the community safety plan or the responses to COVID, the DHRs, or the next priorities.
If I could, Chairman, I'd wish to speak generally, and I'll speak at the end.
Okay, thank you very much.
Thank you.
So have we got any questions so far? I can't see anyone coming in on the chat bar. So if you'd like to carry on, Andy, that would be good.
Okay, thank you, Chair. So one of the things that we particularly wanted to highlight in our annual scrutiny report is the good work we've been doing around tackling domestic abuse. It's very much a priority for partners in Dorset. The Community Safety Partnership has got a very clear position statement on its approach to tackling domestic abuse. And it's been something that's had a lot of attention and has been a real concern during the pandemic. So I wanted to just make sure the committee and members are aware of what's been happening. So we've been meeting with our partners regularly since the start of the pandemic to understand and respond to domestic abuse issues, as well as other community safety issues. And we've included some analysis of that activity at 12.7 in the report. But we've done a lot of close working with our frontline service providers to make sure that services are up and running, changing services, making sure we've got the right support services in place for people. We've provided additional funding for services, and we've supported external funding bids to help bolster services. And we've also run weekly communications campaigns to raise awareness of domestic abuse issues and make sure people know where to go for support. And I have to say, you know, there's been a real effort put in by people to work together to understand what's happening and make sure we're putting the right interventions in place. Members will see from the report that based on police statistics, there has been an increase in domestic abuse related incidents over the last year, but not a significant increase in domestic abuse related crimes. The increase in incidents is mainly due to more family and relationship tensions and arguments. There's also been an increase in demand for advice and information, and our frontline providers have had many more people phoning up looking for advice and information and general inquiries about domestic abuse issues. So I'll leave it there in terms of that section, Chair, and again, happy to take comments.
Thank you. I've got an RTS in the box from Molly Rennie, as I would expect. So over to you, Councillor Rennie.
Thank you very much. I would like to actually pick up 2 points first. The drive on page 72, Andy mentions a list of things that are happening. I would like to draw attention to the Drive project. This is a programme for perpetrators. Dorset have done really well to get involved with this, and there's been a lot of work done about this, and I'm hoping that we can actually achieve something out of that. And I'm not being negative, because sometimes perpetrator programs don't work well, or we have them for a while and then they disappear. But the funding is a good pot of money to be able to take this forward, and all the partners seem to be very taken with this, along with the police. And talking of the police, you'll see there's Operation Encompass, which happens informally now with some local police officers and stations contacting schools, but this is a proper operation now that the police are going to carry forward, whereby every school will be aware of if the police have been called out or any partners have been called out to a DA incident overnight, so the school know of any trauma issues that the child might be facing. So I think that there are two things to keep your eye on, and there's new things that are coming forward for people. This is under the scrutiny role. I would like to just sort of bring attention to, if you look at 12.6, the numbers are increasing all the time. And bear in mind, these are just reported numbers. 1 in 4 women, 1 in 6 men in their lifetime. So this is a snapshot, and this is only the people who've reported. And during the pandemic, people have had less opportunity to report, despite the good work done with the special telephone number linked to the 999 call and the Ask Annie campaign and the chemists. But if you're locked in, you aren't going to be able to contact anybody. And I've said this before, the COVID-19 is the best tool for the perpetrator at the moment. And I think when I talk, perhaps if you just take this in mind. But what concerns me is I saw a report that came from the CCG, a safeguarding report that talked about lack of attendance at a herder. And he talks about the herders within the report, and they're the high risk domestic abuse interventions. They are held 4 days of the week, and during each of those, all of the partners would come together. There was a pilot undertaken. Our council have been highly involved with this, and of course, it's not even going to a building and taking part. Usually there's about 2 to 6 cases that you might hear, and it's a quick fix intervention, so everybody knows all at once. They are take over a wee bit from the Marrocks, which were all day, and they could be all day and into the evening. You could be looking at anything from 11 to 26 cases. I read in this document that during the pilot progress through, the CCG said that they didn't have the capacity to be able to take part in the herder. We talked throughout this whole meeting about pressures and how everybody's having to work at the moment and the pressures that are on them. But domestic abuse leads to trauma, death. Any intervention saves lives, and so therefore, taking it down to a council's point, saves money. The whole of it, everything we do is about working together when we're dealing with something like this. And I was really disappointed to see that they didn't have the capacity to attend the herders. They were willing and had the time to do the data to send, but not to be there to talk to that data. So I think really my question is, it's all around, you know, are we confident that all of the partners puts domestic abuse at the core of the work that they're delivering and their holistic approach to this work? And I keep talking about you, John, but I was so taken with John's comments in the chat bar at the very beginning. We can't wait till the end of this pandemic to review what happened. We should be just doing it all the time that's going along, you know. So I would like us to be able to feel confident that all of the partners are fully engaged in the process around domestic abuse, and do they see it as their core business? And, you know, intervention saves lives. Is it a priority for people or not? And then perhaps we could stop worrying about it if they're not seeing it as a priority and just get on with it ourselves. I'd like Andy to, he's smiling. I'd like to see what Andy thinks about that.
Thank you, Chair, and thank you, Councillor Rennie. I mean, it's an important point, and what I would say is, my belief is all organisations in Dorset are very committed to tackling domestic abuse, and actually, you mentioned about the high risk domestic abuse project, and that's a good example of how perhaps our highest risk and at most risk people for domestic abuse. Generally, the model across the country is there are monthly kind of meetings to talk through those kind of shared people and our response to that. We in Dorset didn't feel that that was a quick enough response, so we're now down to 4 days a week of doing that, and that's credit to partners to kind of, you know, change their approach and bring their resources together to do that. I think one of the challenges with domestic abuse for many organisations is it's not the responsibility of any one organisation, and it's also not a statutory requirement for organisations to tackle domestic abuse currently. So it's always up against competing pressures and demands for the other things that organisations must do, and that will always be a challenge. I mean, I think the domestic abuse bill, which is currently going through Parliament, hopefully will become a legal act in April, will really help in terms of getting that legal status for domestic abuse, which does then help emphasise the importance of it being core business. But I suppose my point is partners have done a lot in Dorset to try and tackle domestic abuse. There's always competing pressures, but they've done very well, and they will always continue, I think, to try and put the effort in around that particular issue.
Could I say I wasn't being critical of anybody.
Oh,
you
no.
used the word earlier on, critical friend.
Thank you. Could I bring in Councillor Pipe, please?
Thank you, Chairman. I have a background in the CSP and the Criminal Justice Board, having served as Vice Chairman of those for a number of years before they were merged into just the CSP. And I can see the progress that's been made in rolling out the policies and initiatives as laid out in previous and current forward plans. And I commend Councillor Graham Carr-Jones and Andy Frost in doing so. There are at least 6, if not more, initiatives relating to domestic violence and domestic abuse in this report. The work carried out by Councillor Molly Rennie and others is to be highly commended. I have a comment on the 4 days a week strategic meetings. I know this is a vast improvement, I feel, on the somewhat ad hoc MARAC process previously held. Now, the 6 initiatives underway to support victims and children who are victims of domestic abuse, and a further initiative there I see to help serial perpetrators of domestic violence. But on 12.3, I would like to see something akin to drive, as mentioned in 11.8, under either the prevention or the offenders heading. Is that something that can be done, Andy?
Yes, thank you, Chair. So yes, absolutely. One of the things that the Community Safety Partnership has been very keen to do is understand the whole approach that's needed to tackle domestic abuse, and prevention and stopping people from offending is a really big part of that. So we want to actually stop things from happening in the first place. So we will look at that, and that does form a big part of our position.
Mm-hmm. Okay. On 12.6, the reduction in domestic assault and violent crime in October to December 2020 is hopefully one of the signs we need in reducing domestic assault and violent crime. You know, from the initiatives that have been put into place. I know the COVID pandemic is not helping in this in any way, just despite Molly's suggestion that it is a good tool at the moment. I know where Molly's coming from, so I'm not having a go at Molly on that. And on 13.6, you mentioned the Crime and Disorder Committee. Who actually sits on that Crime and Disorder Committee? Is it members, or is it an internal Dorset Council
it's
committee?
So through you, Chair, the council has to have a legally a crime and disorder committee, but how we do it in Dorset, which is the same as many local authorities, is we add that to another committee's function. So it's actually this committee, but also the People and Health Overview Committee that come like jointly form the Crime and Disorder Committee, and this committee is really about looking backwards at what's happened and scrutinising from that respect, and the Overview Committee is about looking forward to policy and other practices.
Yeah, so this committee is it really? Yeah, great. Okay, thank you very much. Thank you, Chairman.
Thank you.
I do commend the report though to members. It's a good report.
Thank you. I have been asked by Teresa Levy if she could come in to speak. Teresa?
Thank you, Councillor Taylor. I really just wanted to respond to some of the issues that Molly was raising around the CCG and herders, mostly because frustratingly Vanessa Reid can't access her microphone to be able to respond. So I'm responding on her behalf, but also from a position of some reassurance around how we've been managing this through the safeguarding process. So the CCG, obviously, as commissioners, wouldn't be attending herders, other health providers would be, but the CCG absolutely would be responsible for ensuring that that attendance was taking place and that that was being effective. And that would be reported back through both the Community Safety Board and the Children's and Adult Safeguarding Arrangements. And I can assure you that not only are our colleagues in attendance, but they're also often chairing those herders. It is something we look at really closely, Molly. I don't know whether the report's got a bit confused there, but it's something that we'll take back, Vanessa and I, to the safeguarding arrangements and make sure that that attendance is really tight.
Thank you. I do know that they chair one a month, but when I read the report, it just felt that they weren't sitting there. So we don't need to do anything more about it at this moment.
I believe not, but if we do, I'll bring it back to this committee.
Lovely, thank you.
Thank you.
Okay, thank you very much, and thank you, Teresa. Could I go to Graham Carr-Jones, Councillor Carr-Jones, just before, as the portfolio holder, just before I wrap up this item, please? Are you there?
So, I'm there, Chairman. Struggling to
Thank you.
reach the mute. Struggling to find the mute button. Now, I just wanted to, before you wrap up, Chairman, just to really to thank the members and just to really this it's the all. We need to take ownership of it. It is ours, but mindful that it's a partnership. It's not just Dorset Council. It's the other partners involved as well. So on that one, Chairman, can we just thank Andy Frost and his small team for the sterling work they do. I think that sometimes we don't get enough recognition. That events take over, but it's just some really, really important work that's done by the team. And from me, I really want to thank Andy publicly, and I'm sure your members would like to join me in that. Thank you, Chair.
Thank you very much. I think I might have jumped the gun a little bit because I don't think Andy has finished the report yet, because we haven't looked at the DHRs. I don't know whether you want to comment on the DHRs, Andy.
Thank you, Chair. I know we're short of time, so I'll be very brief. But one of the domestic homicide reviews is one of the really important areas of work that the Community Safety Partnership are involved in. So when there's a death, which may be related to domestic abuse, we are required to have a look at that and do a review if it meets the criteria. And the point of those reviews is to learn how we can improve our approach to tackling domestic abuse issues. And the report you have in front of you just sets out a number of themes that have emerged from those that are relevant to the council and other partners, and the response that's been put in place. And I'll very briefly just cover the last point, Chair, which is about the priorities for the next 12 months. And that's again set out in the report, but we're currently doing our needs assessment. We will continue to respond to issues related to the pandemic. And a big thing that's coming up for us is around preparation for the Domestic Abuse Act, which we hope will come in April.
Okay, thank you very much. Is there anybody commenting on that? Councillor Pipe has come in, please.
Thank you, Chairman. On the DHR subject, Andy, in the past we've had 2 suicides that were perhaps linked to coercive control by a partner. Neither of these met the criteria for a domestic homicide review. Was that because the criteria, the bar is set too high, or was there no evidence of what was thought at the time to be coercive control?
I think through you, Chair, I think the criteria is very clearly set in statutory guidance, so we kind of follow that very closely, and the guidance is intended to try and learn lessons. So I wouldn't say it's set unnecessarily high. It's just whether or not it's the most appropriate route. The other thing that happens sometimes is it might be more appropriate to do a different type of review if it doesn't necessarily meet a domestic homicide review criteria. Other types of reviews take place and happen. So there can be different approaches that are taken.
Okay, thank you, Chairman. Thank you, Andy.
Thank you. I think I would like to round this up now because I haven't got any other questions in the chat bar. I think this is a very small section, Andy's section are, that, as Councillor Carr-Jones said, they do some absolutely brilliant work, and they trot along quietly in the background, but without them we would really suffer as a community, as a council. So I would like to say thank you to this group and the work that they've done and acknowledge them. And if we can get some more plugs in for them across the council, because I think they're often not given the recognition. We tend to think of antisocial behaviour. We tend to think of policing as being purely a policing issue, and it's not. It's also a council issue. And there's a lot of really good work that goes on from our officers that should be acknowledged here. Could I ask Fiona, do we need to take a vote on this one? Because this is part of the statutory work that this committee does. So basically our recommendation is to consider and comment on the committee safety annual report. So do we need to vote in any way to say that we have considered this report as a committee, or are you happy to take this just as it is?
Happy to take it as it is. Members considered and commented on the annual scrutiny report.
Okay, and that's fulfilled our statutory duty. Yeah. Thank you very much. If we can move on to more or less the last item, which is the committee forward plan. If I can just quickly run down, the committee forward plan is still evolving, which is, I think we are getting to where we need to be, but we're not where we need to be with it yet. We have a couple of things that have been added on today, and I would suggest that for the 20th of April, we take off the housing one, which is almost morphed into this looking at as a half day with a focus group on the holistic approach to homelessness. So I would like to take that off. I've had a request come in for the forward plan, which was, I was talking to members around the need to put something on from children's services, because we are very children's services light at the moment, and also the need to look at how COVID has affected our young people. And in discussions, we were looking at particularly around young people who aren't at school yet, young people who aren't in mainstream school, and NEETs. And in discussions, we've probably looked at widening this slightly with an eye to the St Mary's project that is coming online. Excuse me, and then the need to look at SEND. So I think, if possible, I'd like an additional item on the April's agenda, which I'm quite happy to talk to Teresa about, to look at how we would like that taken forward. But I think that would be a really useful thing to put onto our forward plan for April. And I haven't got Teresa shouting at me, so I think I'm spot on there. I think just reporting back on the working groups that we have got up and going. We have got one on housing associations and the plan to have an inquiry day on that. We are looking at how to take this forward and how to prioritise it at the moment. It is a substantial piece of work, and to do it justice, it needs a little bit of thinking about and how we're going to do this. So please bear with us on that. So we have already a committee, a working group set up for that, which is myself, Molly, Councillors Dunseith and Councillor Somper. And I did say in the last committee meeting that I would probably extend that to other members, because I am quite aware that there are members across this council who have various interests and various skills. And I think to help this working group and to help this committee generally, I think we should have a principle that we can extend outside of this committee and co-opt other members in to help us. I am aware that there is a working group, an informal working group that has carried on over the last year or so, people just in the background chatting about housing. And I'm sure there's a lot of people who would have an input into that. And it's interesting when we've just talked about grants and nobody from within this committee had got the capacity to take that forward. I think this is quite an important point, that we should have flexibility to go outside. So when I ask for people, if we haven't got people to do this, if you want this work done, please say, and then we can look outside of this committee for people who are likely to want to help us working on these. I think that is all I want to say on the forward plan. And we've sorry?
I've sent you an RTS.
Oh, sorry.
When I wanted to ask, I'm just talking about children, could you add in, or will it make it too big if we look at those other children that are also children and young people that are also at risk, exploitation, county lines, things like that? Because we've now got these targeted youth workers as well. And I saw in Andy's report, he had included the work at East Dorset with a youth worker for children within his community report, or does it not fit into what exactly you're wanting to look at the moment?
I think that may be a separate piece of work, and that may be a piece of work that comes out of the youth EAP.
Okay.
Is my thought on that initially. I need probably to give that a little bit more thought.
Okay, I didn't want to cloud and mess up some work plan ahead, so that's fine. That's fine.
Okay, so yeah, hang on to that thought, and we'll look at it possibly in a different way. Could I just have a quick look for, would members just please consider the cabinet forward plan? Is there anything on there that you would like to pull in for us to have a look at? This committee has got the facility to pre-scrutinise any of the decisions that are going to be made by the cabinet. But we do need to bear in mind that it's not the role of this committee to delay any cabinet decisions. So we need to have good time to pull these in. And this was a piece of work working very closely with Overview as well, because it may be reports that are coming from Overview. So I think I haven't got anything I want to pull in. Does anybody want to say anything on the cabinet forward plan, please? I'm not seeing anybody wanting to come in and speak on that.
Robin.
Can I just ask?
Okay. Yep.
Can I just ask about the new hospitals programme and what does it mean for Dorset? Is there anything that we might valuably comment on when we see the plan? And would it be helpful for us to make that comment before it gets to cabinet?
The new hospitals programme and what it means for Dorset is an agenda item on our 20th of April. Where have I missed it on the cabinet forward plan? Is that on our forward plan or the cabinet's?
Chairman, it's Fiona here. Perhaps I can help. It's on our forward plan.
I'm sorry.
It's on our forward plan for April. Yes.
I'm looking at your screen. I'm looking at your screen, and the problem is I've been trying to follow the agenda on an iPad, and it's stuck at page 67, and it won't go past page 67.
I've tried to make this agenda as short as possible. Just for reference to committee, I have asked that committee papers be no longer than about 4 or 5 pages long, and I hope that has been helpful today. So I don't know, I will admit, I don't know what the new hospitals programme and what it means for Dorset exactly is. I've been asked to put it onto a forward plan, and the officers have asked to come forward and present that to us. So I'm still needing to bottom that out, but you will know before the 20th of April.
Bill
Okay.
Yeah, and Bill Pike's got a comment. Could you show the cabinet forward plan?
So.
Not you, I expect, Fiona.
Yeah. Yeah, here it comes. Sorry, can you take it a page at a time, please, just to give councillors a chance to look at it? Thank you. While we're looking at this, I will say I have got some concerns over the cabinet forward plan and how it fits in with this committee at the moment, because as we haven't got a meeting until April, and there's in all probability things that might be going forward to the cabinet in March that we may want to look at, but we won't be able to because of the timing. So I think there is a piece of work that we need to do that's around the forward plans when they're published, that if we want to pull them in to have a look at, we need to be proactive as members of this committee. Okay, is there anything on the March agenda that we would like? Okay. They've got their quarter. Sorry, the reason for the member of the public, there's something that's gone into a chat bar about a cat laying on a keyboard, which I've found quite amusing. It is actually important because of what has been said in the chat bar. So is there anything on this page that we would like to be pulled in to have a look at? See, we've got Dorset TICs, that could be interesting. And the consultation responses, that isn't for this committee. Could I have the next page, please? Thank you. There's an interesting one. Health air quality strategy. I think that is possibly more for the other scrutiny committee, but it may be us. Okay, could I have the next page, please? And the next page, please. All the performance monitoring will come to us automatically. And the next page, please. And that's the end. Okay, so nobody has put in the chat bar that they would like anything additional put onto the agenda. So I think that is that part of the meeting finished. Can I just go back onto where we are? And I've lost my agenda. Right, we have no urgent business and we have no exempt items. So on that basis, I would like to call an end to this meeting and to thank everybody this morning. I think it's been a really useful meeting. I'm amazed we have got through this in 2 hours and 40 minutes. And I'd just like to thank everybody for attending and for their input. Thank you very much, everybody, for staff, for councillors, and look forward to seeing you in April, unless I'm seeing you at some other time. Thank you very much.
Thank
Goodbye.
you.
Cheerio.
Bye.
Thank
Bye.
you.
Thank you. Bye.